today we'll start by discussing the role of healthcare environmental hygiene in COVID-19. COVID-19 that is really taking place in our lives every day, whether it's in the hospital or even at home. But what is this virus? So the slide is showing you the SARS CoV-2, which is actually coming from the primary host, that is bats, as you know. The transmission at the beginning was probably through an intermediate host that we all think today, as of today, is as we say, the pangolin, but it's not 100% sure. And then this virus that was a bat virus became a human virus. And this is where we started with the problem. Because this human virus has a very high potential for human-to-human transmission, and that was really the problem. And then, of course, not only from human-to-human transmission, but then this virus is highly capable of inducing disease among humans, and disease with a very specific challenge because the population has no antibodies against the virus, of course. The disease has no treatment, no specific treatment, and there is no vaccine against this virus. So the purpose of today is not to discuss therapeutic options or vaccines, but rather to discuss what is the role of environmental cleaning in these. But before that, I want to show you a next slide, which is the burden of disease, the burden of the problem. You see on this slide that this is a pandemic, as you know. More than 4 million people have been touched by the disease yet. So sometimes the disease is very minor, sometimes it's a lot more important. But as you can see, more than 1,300,000 people affected in the US, second Spain, United Kingdom, Russia, Italy, and so on and so on. But anywhere, all over the world, we are talking about a real pandemic situation. The next slide is actually summarizing for you some curves. There are many, many curves that I could have selected to show you today. But you see 4 million cases as of May 11, 2020, 63,000 in Africa, 662,000 in Asia, 1.7 million in North and South America, 1.5 million in Europe, and in particular with country the most affected being Spain, United Kingdom, Italy, Russia, and Germany, and around 8,000 in Oceania yet. And as you can see on the curves, you can easily see that the curves are going up in some place around the world, in particular in Asia and in South America. And this is also the case in Africa, where the disease diagnosis is a little more complicated. And as you can see, this is by far not the end of the story, because even if the curves has somewhat flattened in Europe and in North America, we are still talking about a huge burden of disease with a high risk for the so-called second waves in most of the countries that have been gone through the first wave. So the next slide is showing you about the way this virus is transmitted. As you know, there would be one infected individual among several. Today, in most of the countries, the proportion of the diseased population is around 5 to 10%, but it's increasing progressively. You know that the disease could be transmitted by the so-called droplets. So it means that when you are talking, when you are coughing, or even more, more when you are coughing and actually sneezing, you are spreading the virus. The virus can spread by these droplets in the environment. You can go directly and infect somebody directly by coughing on somebody, for example, on the top of the panel. And on the bottom of the panel, of course, you can actually cause and spread the virus on the environment. And then your hands are taking the virus, like if you take something that has been contaminated, and then you bring your hands to your face, whether it be to your mouth or your nose, and then you got it, or your eyes, and then you got infected. So that's the way the disease spread by contact, whether direct or indirect, or by droplets. And these are the two entities that make the disease spread so fast. The next slide is summarizing for you the issue about transmission patterns among or from healthcare workers. And that's for us is very important. You can imagine on the bottom, on the top of the slide, COVID patients that actually could be in close contact with the healthcare workers, and the healthcare worker could be again in contact with non-COVID patient. And if hand hygiene is not respected, if the material that was supposed to be used is not used, the healthcare worker can actually be sick himself or herself or transmit the disease to the next in the line, which would be a non-COVID patient to start with, and then will come a COVID patient. But importantly, healthcare workers are also part of the community, and that's very important. And assuming availability and adherence to personal protective equipment, the risk of infection among healthcare workers might depend primarily on community circulation of the virus. In other words, healthcare workers can get infected from patients, but also from the community, whether it's a general community or the community within the hospital. I don't want to discuss it further today because that's not the purpose of my talk, but that's a real issue. And I can tell you that I'm spending a lot of my days today to work on this process only. The next slide is, yes, as Rod told you already, today was supposed to be the second healthcare cleaning forum, and it would have been appropriate to discuss all of this with you, but we can't do it physically, so let's do it virtually. Healthcare environmental hygiene is crucial for fighting COVID-19. Why? Because you need to clean your hands all the time, but you also need to clean the floor so that when you touch the floor, when you touch the surfaces, when you touch anything, you make sure that your hands are not contaminated, and then that you will not contaminate somebody else next in line, if I want to say like that. So this is a really important issue that we have to discuss today together. Now, this virus is, as you know, a very easy virus to kill. So this virus causing so many diseases all around the world is actually an RNA virus, typical RNA virus, typically an enveloped virus as shown on the screen here. And those enveloped viruses are extremely sensitive to anything we use in the healthcare environment to actually clean, whether it would be cleaning our hands or cleaning the environment. And that's very important take-home message, because at the beginning, everybody thought that this virus was something that was extremely difficult to fight with. It may be difficult to fight with, but not for reasons of resistance or anything else. This virus is extremely sensitive to almost anything you use to kill this virus, whether it will be on your hands or in the environment. So in fact, it's important to remind here that all types of products kill SARS CoV-2. So COVID-19 is extremely sensitive to heat, detergents, alcohols, other disinfectants, steam, UV, and so on and so on. They need to be used appropriately, as always. There is no difference between what we do most of the time, but this virus is very sensitive, which is very good news, because what we are using every day in the hospital, if we are using it appropriately, will do for COVID-19. And that's a very important take-home message. Now, speaking of product use, there are lists of products. And here is a list, but there are many, many different lists. You can look at the reference on the bottom of the page. You can access those references. And there are over 300 disinfectants that works on SARS CoV-2 or COVID-19, according to the US EPA, to the FDA, with FDA reinforcement, according to ECDC, or whatever. So again, this is not an issue of the product that would work or not. The issue is the way you apply the product and the way you do to apply the product. The next slide is just also to remind you that in facilities, you can have all sorts of approach to clean surfaces that are already existing. All those technologies work. They work on COVID-19 as well as they used to work, or they are currently using on different bacteria, different viruses. Again, it's not an issue of the availability of the tools or the technique. The issue is whether those techniques are appropriately applied to make sure that it would work. So this is extremely important. The next slide shows you one of the very, very important problems we have had. As you know, we have had a problem all over the world with the lack of masks, for example, with the lack of gowns, with the lack of many things that was needed, including medications, including ventilators, and so on. Now, importantly, the reusing of some disposable is absolutely feasible. It's not always very convenient. It's not always very inexpensive. It's frequently associated with a lot of logistics, but it is feasible. In our institution, we have been reusing masks. FFP2 masks have been reused, reprocessed. So the role of central sterilization in this process was absolutely critical. Today, our hospital that has sustained more than 800 COVID cases doesn't need to reuse disposables right now. But of course, it's important to have the technique masterized so that if we have to be confronted with a second wave, we would know how to do it and when to do it and what are the mistakes not to do. So this is really important to also keep this in mind today. The next slide is summarizing for you these. Reprocessing using steam, dry heat, H2O2 vapor, UV, alcohol, and other chemicals may work. So you may have a very specific role in a situation where we are lacking almost everything. We were lacking almost everything. Nowadays, in Geneva, it's not a problem anymore, but it has been a problem. So it may be that it will be a problem in New York, in Boston, in Australia, in London, whoever and wherever. So it's very important to understand that you need to look at a variety of variables to find the right solution for individual facilities to actually react appropriately to the lack of these very important tools and resources that you are missing. Remember, there is no single solution. No one size fits all when it comes to environmental hygiene in hospitals. And this is very, very, very true. So we have been facing too many different challenges that we have been sort of really succeeded at solving. So I really encourage all of you to be working close to hospitals so that you find the best solutions for these and these part of the problem. Now, where does the information coming from is important at the current time of this pandemic. We are all suffering from too much information, too many information. This pandemic has been what some people deem to call an infodemic, an epidemic of information with sometimes very bad information. And this term infodemic has been used by WHO Director General Dr. Tedros, telling, please, expert, only express yourself if you are real experts. Why? Because there have been many competing agendas of expert and so-called experts or interest groups. And information sometimes has been really bad, conducting to the concept that we all know very well, and in clean hospitals, we have been working on this, as you know, the concept of misinformation and fake news. Misinformation and fake news is really a problem and has been a real problem at many different levels in the fight against COVID-19. And we will certainly come back on this issue. But I can tell you that we have been spending days fighting against epidemiologists, pretending like, for example, in our country, there was a prediction of 30,000 deaths from the first wave, whereas we had only 1,500 deaths in our country. So the difference is huge, as you can say. There have been misinformation about environmental cleaning by the tons, telling this doesn't work, this doesn't work, this doesn't work, and it was absolutely not true. So we had to fight against misinformation and fake news, and this is absolutely not good because you are losing time and money in this situation. The next slide is summarizing it for you. Here is an example of putting some context to the aerosolization debate around SARS CoV-2, a paper that we put in place with the Clean Hospitals team, academic team, Alexandra Peters, Pierre Parnex, John Otter, and myself. Well, COVID science could get misinterpreted by the media, and that's very, very clear. COVID is not an airborne virus, but can be aerosolized during certain medical procedures only. This does not mean we need to worry about air conditioners spreading of the virus. This would be totally foolish. So it's just an example of this type of misinformation that we have been suffering off during this COVID situation worldwide, but there are many, many others that I can summarize for you. Well, the next slide shows you that sometimes some misinformation could be quite subtle. There have been all sorts of experts telling you all sorts of opinions, going into the theory of complot, going to misinformation and information that are really not useful for any of us. All over the world, government and organizations are disinfecting outdoor areas that are not cleaned first, sometimes in persons, sometimes with drones. This is not valid. This is not useful. There is no evidence for this practice. Breathing the spray can be dangerous for the one spraying the material, and it is also really bad for the environment, as far as we know, in many situations. So this is to show you another example of what has been sort of a switch that we didn't want to see in this type of situation. And I would recommend all of you to really think about it before making any recommendation in the future. The next slide is telling you about the role of education. And I'm very pleased today to be here with Martin Kierman and Alexandra, because one of the focus of Clean Hospitals is really education. Education of the public and in healthcare facilities. Education is so important. infection prevention and control, so-called IPC measures, are really key. They are very simple. They just need to be taught appropriately with the right tools at the right person at the right moment. We have specific products and protocols. That's easy. We can use them. As situation unfolds, there is a lot of information, some evolving and changing, of course, some seemingly contradictory. This is very difficult for people to understand. So that's why we need to concentrate the education at the right place, use the right experts, use the right tools. And I'm looking forward to see more and more tools produced by the Clean Hospitals team so that we can homogenize the teaching all over the place. That would be very, very useful in public as well as in healthcare facilities. Well, the next slide, it's important to remember that the situation of COVID is a stressful time for everyone, especially essential healthcare workers. We need to be sensitive to the concerns of stressed populations. We need to ensure team cohesion and empowerment that is more important than ever. So good education, clear protocols, direct communication, quality control, constructive feedback, and getting and keeping a humanistic approach are really absolutely key in our fight against COVID and in the success we will have against this disease. The next slide is just to invite you to join our network of relevant stakeholders to improve the healthcare cleaning, environmental hygiene, and protecting patients and employees and the environment. This is our mission. This is why we created Clean Hospitals. I'm very thankful to Interclean. I was tempted to say Interclean Amsterdam, but today I'm in Geneva, and Martin is in London, and Rod is in Amsterdam. But thank you to Interclean to host us and to allow Clean Hospitals to really try to promote and to help all over the world those who are actually interested in joining the right group of experts with the right group of tools and empowerment facilities so that we can succeed against this disease. With these, I would like to thank you all for your attention. We'll be more than happy to answer questions at the end of this seminar today. Thank you very much.
Thank you so much for the presentation. We have a lot of questions from our audience. Some are very, very specific, and to those, we're not going to ask them live because they have to do with specific dilutions of certain products. But what we will do is we will post all the relevant documents that you need to get all the specific answers for your cleaning protocols that you're implementing in your facilities. So we're going to stick with slightly more general questions. And I'm just going to open the QR mode. We're having a little bit of a problem. There we go. So what is the risk for extended wear of the mask for healthcare workers?
Yeah, can I answer?
Mm-hmm.
Yeah, okay. So there are several types of risks. When the mask is worn for a very, very long time, when this is in particular this very specific type of mask, I may have one here, I can show it to you. It is called a FFP2. You have this FFP2 mask here that I can show it to you. These masks, sometimes when you wear it for a very, very long time, like this, you can actually have marks on your face or even scars and wounds on your face. And you have seen it because Time magazine actually provided photos of these healthcare workers wearing too much of these masks for too much of a long time under stressful situation with resulting problems on their face. So that's an example. Now, there are other examples by using a very simple mask. Sorry, I'm using another mask here. This is a very simple, what we call surgical mask that you use like this. And I made typically a mistake exactly for you to show, because before you use this mask, what you should do is actually use alcohol-based hand rub. You need to rub your hands or to wash your hands before actually using a mask. Why should you do that? So I do it here with an alcohol-based hand rub, because in fact, when you wear a mask, you carry your finger at your face. So when you carry your finger at your face, you may touch your eye, you may touch your nose, you may touch your mouth. So it would be a mistake. You could cross-transmit to yourself the virus. So you need to clean your hands, and then you need to wear your mask appropriately, make sure it's below here and on the top and organized, and then no problem of using this mask. But after you remove your mask, of course, you bring your fingers to your face and you have to throw it away, and then again, you have to actually rub your hands. In this case, I'm doing it with an alcohol-based hand rub, but I can do it with also soap and water because it works also. But I'm doing it for you because it is very important once you have been using a mask to clean your hands. So I would say the third element that could be a danger when you are using a mask is that if you use the mask, sometimes you feel extremely comfortable and extremely protected, and you may make mistakes. The mistake being that social distancing should be kept when you are working. Even if you wear a mask, you should try not to be too close from another colleague. If you have to be very close from a patient, that's your job, you have to do it. But nevertheless, the wearing of a mask is making you sometimes forget about hand hygiene, forget about social distancing, forget about some very important other elements. So that would be my answer to this very important question.
Thank you very much. Do you believe that there's a need to supplement current protocols with additional measures, or is it more a question of staff not currently following the existing protocols?
Currently, to be very honest, the protocols are okay. We have all the tools necessary. We much better need to focus on education and implementation of the right protocols by the staff. That would be really the way to make sure that the adherence or the compliance with the protocols is the best as we can, and that would help a lot.
Thank you. Could you explain to us the difference between cleaning and disinfecting?
Yes, of course. Cleaning, you can clean with many things. If you clean a surface, you can use soap and water, you can use a detergent. This is cleaning. When you clean your hands, you can say use soap and water, or you can use alcohol-based hand rub, but these actions are a little different. If you use soap and water, you just remove bacteria. If you use an alcohol-based hand rub, you kill bacteria, and at that point, you are actually doing hand antisepsis. And this is the equivalent in the surfaces of disinfecting. Now, disinfecting means that you not only clean, but you also use a product that kills bacteria from the surface. And this is the term disinfecting is precisely referring and should only refer actually to killing bacteria from a surface or from an environment. Unfortunately, there are some conditions where you should do cleaning and disinfecting. Because, for example, if you have something that is very fat, or if you have some greasy thing, you should first use actually a soap or a detergent that clean and then add a disinfectant to really disinfect. It could be the floor, it could be a machine, it could be the environment, and so on. So there is a huge difference between cleaning and disinfecting, as you may understand.
Thank you. I'm going to ask the next two questions together because they concern specific products, but they're coming up quite often. So the first is, can soap and water inactivate the virus? And then the second one that we're asking at the same time is, instead of chemicals, would it be better to use ozonated water?
Okay, to the first question, soap and water clearly cannot inactivate the virus, cannot kill the virus, it can remove the virus. So you apply soap and water, if you have the time to do it and do it well, it's fine. The virus will go. It will go in the water. It will certainly not survive at all because you need cells and human cells to make the virus survive. But it will not inactivate the virus. It will not kill the virus, if you like. Only alcohol or disinfectants can really kill the virus. To the second question, can you use ozonated water? Yes, you can. In some circumstances, it will be very useful, very easy to apply. In other circumstances, a little more complicated to apply, depending on the surfaces you want to clean and to actually liberate and where you want to eliminate the virus.
Thank you. Next question. Is vacuuming carpets in old people's homes a risk in spreading the virus?
Well, we don't like carpets. We don't like carpets in general. But this virus would not sort of be different than many other viruses in regards to carpets. It's clear that usually we don't recommend vacuuming carpets because we know that there are sources of and reservoir of all sorts of things, whether dust, some bacteria, some viruses, even sometimes some fungi, of course, and parasites. So we don't like it so much. We prefer vacuuming carpet in particular, as you know, in hospitals there is no carpet, and in old people homes we like to sort of not have them too much. Now, if they are not vulnerable, fine enough. If they are really in love with the carpet, we won't remove it, but we prefer not to have too many for other reasons too.
So the first part of this question wasn't written on there, but there's a lot of people worrying about the wearing of masks and breathing of your own CO2, and if that makes you sick.
I see what you mean. Okay, if you use this mask, no, not at all, because it's minor. It's absolutely minor, and this type of mask cannot make you retain your CO2. Also, it's not the CO2 I'm looking for. If you are a pulmonary obstructive disease patient, sort of being sick, I would not recommend you to use such a mask. I would recommend other people around you, if they want to protect you, to wear a mask, but not you as a very sick person. Now, this type of mask that is used only by healthcare workers in some situation, very rare situation actually, is a little bit of a different issue. It does not retain CO2, but it may decrease a little bit the amount of O2 that is breathing in your lungs after you have been using them for a long time. So it's not a real problem for regular daily life, but it may be a problem in some circumstances on a very rare situations.
Thank you. Could you comment on the effectiveness of the so-called nano products that claim disinfection protection for 90 days on surfaces?
Yeah, well, I haven't seen the science behind this type of product, but I can tell you that, or this one that you are referring to, but so far there is no evidence in the laboratory and no clinical evidence, of course, because if you have no real evidence in the laboratory, how would you like to have evidence in clinical practice of the real usefulness of these type of approaches? I mean, I've never seen in my whole career a surface that would be remaining protected from viruses or bacteria or parasites or for more than a few hours only. So 90 days seems a lot to me.
Thank you. So what's your suggestion for an infected object in facilities? What do you do?
Well, what do you mean infected objects? I mean, like for example, people are asking me in schools, can people play with a ball? Children say, yes, of course, they can play with a ball. I will not disinfect the ball after they had played with a ball. It all depends on what you call object. Of course, if you work in a healthcare facility where you have a patient and the patient has a thermometer, a blood pressure, cuff system, and so on, this is the routine of what we are doing every day in the hospital. And it's no different for COVID than it has been for any other bacteria. We're using the same product, as I said in my talk, using the same protocol, but the most important be that the protocol be followed. And that's the most important.
Great. Thank you so much. We unfortunately don't have time for any more questions, but I would like to take the opportunity to thank Professor Pittet for being here and for all of his expertise.